February was a busy month for cardiology specialist Dr. Nitza Alvarez, who spent a great part of Heart Health Month taking the time to educate people about heart health and prevention. We caught up with her at the new Covenant United Methodist Church in the Villages, where she appeared as the guest lecturer of their health education speaker series.
Here we are once again in our community, educating our community about heart disease, how this condition is still a life threat, and what can they do to prevent this and being one of the statistics. Unfortunately, studies still reveal that the majority of the patients don't know that cardiovascular disease is still their #1 killer. And this month we are actually trying to create awareness of how women are different when it comes to cardiovascular disease. We know that recent studies shows that 70% of the women still don't know that cardiovascular disease is a life threat. So I'll continue doing this until we know that this is heard all around the world, and patients, when you ask them, they will know to answer cardiac disease is my #1 risk, and I know what to do to prevent it.
She cares about her patients, and she's very into prevention so that she doesn't have to be doing other things other than prevention, and I enjoy that.
I'd just like to get a little education on what people can do, especially for myself, just what we can do to prevent having to get any kind of stent. Want to avoid any blockages. I've seen too many people with having heart attacks and that type of thing, and whatever I can do to avoid it, I want to do.
Today we're going to be talking a little bit about what causes atherosclerosis, which is the cause for heart attack. We're going to be talking about stents and, take away the myth about stents preventing heart disease and in what settings are stents good or not, so patients understand that unless you make a drastic change in your lifestyle, your risk for cardiovascular disease will stay. We'll talk about the differences in cardiac disease in women and men and what can we do to prevent that. I want them to know the importance of exercise in their lives. Even the minimum amount of exercise is better than no exercise, and how they can make little modifications in their diet to reduce the risk of cardiac disease. Atherosclerosis is a disease that starts early in life, and I want to emphasize today that it's never too late to make changes, but it's never too early to make changes. So if you're here because you have cardiovascular disease, then learn what can you do to prevent that from progressing, but also to spread the word to other people that might not be here, that if we start making modifications early in life, our chances are better to survive this condition.
As part of her year-round commitment to help you stay heart healthy, you can join Dr. Alvarez every second Saturday of the month for Walk with a Doc. Participants will enjoy a brief presentation on an important health topic, followed by a walk at your own pace led by Dr. Alvarez. You'll find information on Walk with a Doc and the Tri-County Heart Institute when you click the Preaching Heart Health StoryLink icon online at yourhometownhealth.com.